Just one day. I know. See tomorrow, we're gonna try to find you guys early, take pictures.
First time.
I'd be like that. You know, I'm still gonna do this. Yeah, I got it didn't give me much of this way that they kind of yes. Yeah, that's what I'm saying. When I got my 18, so I get like.
Traffic, I know, I have traffic issues. So we're gonna give out just a couple minutes. Something else that's really important. They want to say. Yeah. That's interesting. The same thing when I was. And all when I. My mom was not. You just see shit's going on.
It's just like.
Sign up for comments. You gotta go to work.
Yeah. Merle.
Very new.
The last time. ¿Dónde ahora esa voz de la película? Yeah.
Nice question. No.
Wait, what's right here? Everybody.
And some people feel she don't get that. You don't get discrimination. When she had done finding out about it. It's like, what's going on? It ended up having. So, but I mean, I have contact. It's always doing something.
Right, Darlene, Darlene.
Was 9 years ago.
Probably did sort of this year. And you didn't talk about I want to thank you all for coming. I know it was kind of like mandatory, but I'm sure I didn't put that down for them, so they're getting a little reward for coming. I want to thank them for coming, because I think they're going to think that this is a really great event. We have 4 speakers that will be here talking to you about their personal stories. So it's not like sometimes you go to a little seminar and you're there and you're sitting, you have fallen asleep. These are going to be great stories, but sad stories, because things happened, because people in healthcare maybe didn't pay attention, didn't communicate as well as they should have. Not trying to point fingers at people. It's more the fact of you're entering into a profession that is, can be life-changing for people. So it's great for you to have that understanding going into it. So maybe you'll think about your patients differently when you're in there, thinking about this impacts a lot of people when unfortunate things can happen. So I think by understanding, I could preach to you all the time about how many statistics are out there with medical errors and things that were overlooked. in healthcare. And we always say, oh, yeah, those statistics are awful, and you hear about them all the time. But I think what really impacts you is hearing personal stories. So I'm thankful to our 4 speakers. We're going to have first Linda Lowman. She's going to discuss and talk about her personal journey with her daughter, Paige. And then we're going to have Ed Salazar, and he's going to talk about his personal journey as a respiratory therapist. Some of you have met him because he came in to talk about some medical equipment. He's now going to talk to us about, he's a respiratory therapist talking to us about his medical issues that he had concerning his son, Chris. And then we're going to have Darlene, Christy, and then her husband, Earl, the twirl. And they're going to talk about, I think it's more Earl's journey, but how it impacted Darlene and changed her course of her career because of things, because we all want to do something. We want to like change things for the better. Isn't that why you're going into healthcare? You want to do your part. You want to, go in and be able to help people who are less fortunate in a way because of their health issues. So I think we all come here with different reasons, but it's all to still trying to better everyone's lives. And I think when you go into healthcare, we really are providing a service to people. So we don't want to lose that part of the empathy toward what we're doing and make sure we're diligent on our practice. So we're first going to start with Linda Lowman. Linda has a master's degree in education and is a certified infant and toddler development specialist. So those of you interested in PD and everything, she's the lady for you. She's a champion for patient safety. And she's retired as a neonatal ICU developmental specialist after 39 years. And she's currently an instructor for the NOMAS International. And that has to do with...
it's a neonatal feeding course, a certification course.
Perfect. So we're going to have Linda start off. I'm going to be playing this behind her, but we're not going to have sound, so you can kind of see her daughter, Paige.
Depends on if they can hear me.
Right ahead. You just got to make sure you speak.
I guess you can hear me. Okay. You want me to sit or stand?
It's recording already.
Oh.
You like to sit there, everybody else should.
Sit here.
Or you can sit there, or I can bring you up there.
I'll just stand here. How about this? Sure. Okay, so I'm going to talk about my daughter. This is her last journey. She had a number of hospitalizations throughout her life. This was her last journey in the hospital before she passed away. This is a subject I'm very passionate about because she was the most important person in my life. I'm going to focus on the things that I was upset about because those are the things that we can learn from and make things better for the next patient. But just know that there was a lot of good that was done. There were some amazing people that took care of her, but just one mistake can kill, just one. So who was she? And you'll get an idea from the video. She was my daughter. She was born premature at 24 weeks, now 40 weeks is term, so she was 4 months premature. And because of the complications of prematurity, she had bleeding in her brain, and she ended up with cerebral palsy and was wheelchair bound. She was very smart, funny, she was full of joy. She just had this magical way of lifting others up just by being around her. She was really pretty amazing. Her favorite subjects in school were literature and science. She loved thrill rides, not me because I had motion sickness. But she went parasailing, indoor skydiving, swimming, horseback riding. She loved books. She loved her lipstick and her necklaces. Couldn't be seen without them. She left behind a boyfriend, Jose, and her best friend, Kelsey, and she was my hero. So she did have some medical issues in her life. Volume okay?
Yeah.
Okay.
I think everybody can hear, right? Yeah.
Okay. So as a newborn, she had bleeding in her brain. It's a complication that sometimes happens with extremely premature babies. And it was from her extreme prematurity, and she was also a twin, and she had complications with her twin. She had a shunt placed. So a shunt is a little tubing that goes from, in her case, from her head to her belly. Her body did not, was not able to drain the spinal fluid, so she needed a shunt to be able to do that. And she had numerous shunt revisions the first 3 years of her life. And then at age 3, she went to Shands, saw a renowned neurosurgeon in that fixture for a long time. And she was seen by a number of other subspecialists, but she was doing very well. So I'm going to go over the timeline of just the first month of her hospitalization. And then I'm going to go into different areas that were problems for her. So the journey started Saturday night of Thanksgiving weekend in 2019. Paige was 23 years old. She weighed 84 pounds. She was home in bed and she was having a seizure. Now seizures, she had a seizure disorder, but they really weren't a problem for her. But we had to call paramedics. They came to the house and they said, well, she has to go to the adult hospital because of her age. Well, she had never been in the adult hospital. We had absolutely no idea it made a difference, but I learned that it did. And so she was in the emergency department overnight, and she had imaging and it showed that there was bleeding in her brain. And she was placed on a ventilator, but she was off by Monday. And she had an external shunt because the internal one wasn't working. It's called an EVD, and external ventricular drain. And it went from her head to a pump. And it needs to clear all the blood that's in the CSF before they can put in the internal shunt, or the internal shunt wouldn't work. So that's just a waiting game. So we're waiting for her surgery, which happened on December 16th. Hematology did come in and they were consulted. They diagnosed a mild bleeding problem and they said she needed fresh frozen plasma before surgery, and then she's fine. So after surgery, she was never okay. The surgeons came in and said, oh, it went well, but she was never okay. Monday was her surgery. Wednesday of that week, she was transferred to the regular floor in hopes that we can get ready to go home by Christmas. And, but she was just never okay. By Friday, they came in, they adjusted the pressures on her shunt valve. She was still never okay. So Christmas Eve day, I was still hoping she could somehow go home by some miracle, but she ended up spiking a temp of 102.8. So this is 8 days after surgery. So to me, the most logical explanation was an infection from surgery. And so I asked in the morning, I asked for the neurosurgeons to come in. They never came. I waited all day. I kept asking, never came in. Now remember, it's Christmas Eve. Nobody wants to work. They never came in. They finally came in the evening. They refused to examine her. They said she was fine, and they said they signed off on the case. They refused her. The refusal of care would never have happened in pediatrics. The refusal of care started the downward spiral leading to her death. They flat out refused to take care of my daughter. That was their patient. She had a temp, and I was watching her in incredible pain with a temp. And I saw nothing being done to help the pain or the temp. And it was very distressing to me. So I thought, what would I do at home? If I was at home, I'd give her Motrin, I'd give her Tylenol, and I'd put her in a cool bath. Well, I can't do any of those things in the hospital. So I went and I asked for ice packs. I thought I could ask for ice packs. So they said, oh, well, she can have a cooling blanket. Well, they should have offered a cooling blanket. I shouldn't have had to ask to take care of my daughter properly. And I talked to a nurse leader during this time, and I said, I feel like I'm watching her die. She became very defensive. She said they were doing everything they could. I didn't see how that was, they were doing everything they could. When,
I'm sorry, how high was her temperature?
her temperature was 102.8 on Christmas Eve day. By Christmas morning, it was 103.6. It had gone up. And so the most logical thing to me was an infection from surgery. And remember, an infection can cause the temp can cause the fever. Can cause a seizure, which happened a few days later. So on Christmas morning, remember neurosurgery refused to see her. Christmas morning, they consulted infectious disease doc. He came in the morning and he said, I think it's her shunt. And I said, I agree. Can you reconsult neurosurgery? Because they signed off on the case and they refused to see her. And they never came in. So the plan was also to get interventional radiology to get a sampling of her spinal CSF, or cerebral spinal fluid, so they could culture it to see if there was an infection and to start her on the appropriate antibiotics. Well, this is Christmas Day, remember, they never saw her, they never got a sampling, and they started her antibiotics without having a clue what they were treating. So they couldn't treat her properly because they didn't know what they were treating. So because neurosurgery said, oh, it's not us, not us, the team was trying to blame something else. Well, I worked in the NICU for 39 years. I have a lot of friends that are physicians, and they were calling me and giving advice. One in particular was contacting me almost every day. So I ran a lot of stuff by him, and they were trying to find other causes. So one of them was pulmonary embolism. He said, Linda, it's not a pulmonary embolism. Pulmonary embolism does not present with a fever. It presents with shortness of breath and tachycardia. It wasn't pulmonary. So then they said, well, maybe it's your gallbladder. He said, Linda, it's not a gallbladder. He explained why, and he also said that he's worked with other physicians that have blamed gallbladder when it's been a shunt issue. Wasn't her gallbladder, but the team did not drop it, and that complicated things even more. So Christmas was Wednesday. By Friday, even though neurosurgery refused to see her, they pushed the issue, Paige pushed the issue by having a horrific, life-threatening seizure. It's called status epilepticus, and you seize and seize and seize and seize and seize, which is what she did. And so I was standing at the bedside, and there was this very nice male nurse, and he was experienced. He was training somebody. So he was at the bedside, and I said, she's having a seizure. And he was very calm and said, oh, what do you do for a seizure at home? Do you give her oxygen? Well, first of all, she didn't have seizures like this at home. Second, my daughter was having a life-threatening medical emergency as we were talking. And he was doing nothing. I said, you need to call Dr. Tamo, you need to give her Ativan, and you need to call the rapid response team. So he did. Now, I should not have had to tell him how to handle my daughter's medical emergency, life-threatening medical emergency. So the rapid response team came in, and it was headed by our chief of critical care, who's absolutely phenomenal, absolutely fabulous. So thank goodness it was him, because I think she would have died that day if it weren't him on the team. He transferred her back to the neuro ICU, and I had to wait until they allowed me to go see her. So there was a nurse practitioner that came and got me, sweet as could be. And when I was allowed to see her, she brought me down the hall and said, Linda, we know what's wrong with her now. It's her shunt. And I looked at her and I said, I know. But the team would listen. So after the 27th, it became pretty complicated, but the biggest issues were pain management and respiratory. So I'm going to zero in on a few different areas. The first I knew nothing about, that there is a breakdown between peds and adult care. I had absolutely no idea until this experience with Paige. And I learned that Baylor actually has a conference on this issue that they've had for over 20 years. Because it was during COVID, I was able to attend virtually, and I was blown away by this conference and the content and the fact that this has been a problem all over. So, like I said, neurosurgery refused to see her. Not the same as the pediatric model. The pediatric model, they will see you and see you and see you as long as you're still pediatric age forever. I mean, as long as you're still pediatric age. The adult model, surgery, go on to the next patient, surgery, go on to the next patient. And another issue was she was vented after she had that massive seizure. She was ballistic with the endotracheal tube. Every second she was awake, she was absolutely ballistic. And the tube was not secured properly. And I thought, I worked in the NICU at the time. And I thought, if we can secure an ET tube for a baby that weighs less than 1 pound, why can't we secure an ET tube properly for my 84-pound daughter? Now, remember, we're in the adult world, and she's not adult size. She was a pediatric size, even though she was an adult. So I thought, well, maybe they can call the PEDS team. I mean, we have all the supplies in the corporation. All they have to do is call and just talk to somebody with the PEDS team. Well, they didn't. One person was able to take the tube appropriately so that she was a little bit more comfortable. But most of the time, she was absolutely miserable and it wasn't secured properly. Use your resources. It's a strength to ask for help. It's a strength to use your resources when you need them. It is not a shortcoming. And hospitals can be, especially ICUs, can be territorial, and just know that you're doing the right thing if you ask for resources when you need to. The other thing I did is I have some very close friends that are respiratory therapists. I'm not. And I thought, well, maybe they can give me some advice to get her off this vent, or at least off the ET tube. In the baby world, for some babies that are eligible, we have something called NIV-NAVA, and they don't need an endotracheal tube. It's just a cannula. And I thought, well, maybe there's something in the adult world. So one of my friends suggested OptiFlow, which she got, and it was a huge help. And the other thing that was a help, she had a critical care doc. I talked to her around New Year's, and she said, Linda, I'm on service for 4 days. I'll get her off the vent before I sign off. So the chief of critical care, who I said was so fabulous, he talked to me after the event happened where neurosurgery refused her. And he apologized to me. He said they're going to have a debriefing. That's what they do when things go wrong. And then he told me to call the pediatric intensivist, who was a very close friend of his. I'd known this intensivist as long as I've been working in a hospital. So I called her, and she actually had an initiative to bridge that gap between pediatric and adult services. And she said, Linda, Paige was not the first patient to lose her life going from pediatric to adult care. And she's the one that told me about the Baylor conference. Another issue was pain management. Paige was, when she first was admitted, she was pretty comfortable. And then she had the surgery on December 16th. And then she was in incredible pain, which was very unlike previous experiences of surgery with her. Even the most minimal movement of her head caused her extreme pain. And this is a kid with very high tolerance to pain. And she couldn't, because moving her head a microscopic amount caused too much pain. She couldn't eat because that caused pain. And then she couldn't absorb her medicine because it was just too painful. So after surgery, there was an event. They were going to pull the external shunt because they had already replaced the internal one and they didn't need the external one. And they were going to pull it. And I said, can you please give her medication for procedural pain? Well, they refused me. So they took the tube, they pulled it out of her head without giving her anything for pain management. And she immediately had a seizure, which did not surprise me at all. Then, because pain was such an issue, one of the advanced practice clinicians in the ICU suggested consulting a pain management doc. And I thought, that's a great idea. So a few days later, when pain wasn't managed, I didn't see a pain management doc. I asked about it, and she said, well, Paige couldn't have a pain management doc. The pain management doc was only for cancer patients. And I thought, this is an excellent, large, level 1 trauma center. And my daughter cannot have a pain management doc because she is not an oncology patient. It made no sense to me. I contacted my administrator and I contacted the hospital administrator, the hospital president. I knew both of them because I worked there. And they cared, but it didn't solve any problem. It didn't help. And towards the end, I requested palliative care because pain management does fall into the scope of practice for palliative care. Infection prevention, remember that infections can kill. In the NICU, never ever would I touch a doorknob and touch a patient without washing my hands because infections can kill. I could pass an infection on to them. So I'm kind of hardwired for infection prevention. I saw poor practices among everybody. One, I'm going to share just a few things with you. One situation, Paige was getting ready to go to surgery. The hospital has a very strict policy or protocol for preventing hospital-acquired infections. The nurse thought she was going to go to surgery. They followed the protocol. Paige was bathed, the bed was clean, everything was according to the strict protocol. The nurse dropped her medication on the floor and picked it up off the dirty floor without putting it in anything else, a plastic bag or something. She put it right on the bed to go to the OR and just contaminated everything. There was another experience. There was an advanced practice nurse that was doing a bedside procedure that was a sterile procedure. She dropped all the packaging on the floor. That's fine, that's what's done. Then she went and picked it up all off the floor and put it in the trash, that's fine. But then she went to reach for my daughter with her dirty gloves. And I said, not until you change your gloves. There was an RT that came to give her a treatment. And she had her computer with her. And she went from the computer to my daughter, to the computer to my daughter, the whole time she was doing her treatment. That's what she did. Then she took that computer without cleaning it, went to the next patient, and got my daughter's germs. On the next patient, she did the same thing to my daughter. So I talked to a very close friend of mine who's an RT. She said, Linda, you know why she did that? She did that because her caseload was too high. I said, you always do the right thing. It may take you 30 seconds to get a glove, put it on, and wipe the keyboard before and after each patient. I understand that you don't want to be fired, but in my opinion, if you're fired for something like that, then you'll find something better. There was a newer nurse that had her a number of times, a very nice man. One day in particular, he had very poor infection prevention practices. And I told him, and he thanked me. And that is so rare because most people get very defensive. There are ways to communicate in a kind and compassionate way, which brings us to communication. So this was a bizarre situation that I can't believe happened. So remember, we were on Saturday night and Thanksgiving weekend, we were in the emergency department all night, got no sleep. Early Sunday morning, she was admitted to neural ICU. And when they allowed us to see her, my husband and I were in the door frame of the room. Hadn't even gone in the room yet. There were two nurses in the room. One of them very rudely said, you cannot bring any food in here. Well, first of all, we didn't have food. Number two, we hadn't had any sleep since Friday night. This is Sunday morning. I could care less about food. All I cared about was my daughter and sleep. But there are kind ways, and the nurses, there were a lot of situations that the nurses did not treat my husband kindly. When you're talking with the patient, you're going to have to say things that maybe you don't want to say. Or say you're that RT that you have too many patients. But this one particular patient, they've never had treatment before. So you need to just explain them for a second. You have a choice. You can stand up, you can sit down. Well, the research has shown that if you sit, it doesn't take any longer than if you stand. And if you sit, the patient is going to perceive you more positively than if you stand. So I would recommend highly that you get in the practice of sitting, even if it's just for 30 seconds. You're going to have to communicate with patients that are hard to communicate with. When Paige couldn't talk, I had her squeeze my hand or I had her do various gestures. Some hospitals had language boards. I used to use the language line for like an Arabic patient. The other issue that happened was team communication. So Paige was still followed as an outpatient by pediatric neurology. And he was part of the peds team, but he came to the adult ICU to see her many times. The team called him to ask a medication question during the time she was having that massive seizure. They never told him she was having a seizure. That was beyond my comprehension, how you could talk to her neurologist and not tell him that. It was just beyond my comprehension. So in closing, remember, asking for help is a strength. You can communicate difficult things with kindness. Always do the right thing. There were many times during my career that I just kept saying, you do the right thing anyway. You do the right thing anyway. And thank you for your time. Any questions? Will you have time for questions or no?
Yeah, we have time for questions.
Okay. Any questions?
Turn some lights back on.
Thank you.
They're the ones who do nothing. Linda Lowman, thank you so much. You know, part of what we do is caring for patients. So a lot of people seem to make missteps, but as Linda said, it's good to go back and say, oh, I'm so sorry, I did whatever, I was rushed. It's okay to say that. You don't want to give an excuse for, you're always told by the hospital, never turn around and say to a family, oh, I was busy with somebody else, because that's devaluing that patient. So what, they are not as important as the other patient? But you want to make sure that you're attentive. If you have to spend a few extra 30 seconds to wipe down the keyboard, from the computer, because you're always going to have a computer. Right now, you share a computer, but you're probably thinking back. Same thing with stethoscope. Stethoscopes can carry germs. You're doing it from patient to patient. You got to take the pen that you might be using to write things down. You have a dirty glove in one hand, you're picking it up, writing with it, and then you're putting that back down, going to the next patient's room. Are you really paying attention to wipe off that, using the wipes that are around? You can easily wipe it off, just like you wipe off anything else. So it's something that puts in your head. Granted, we all make mistakes. We all get rushed for things, but we really have to think about how can this impact? So sometimes taking that extra 2, 3, 4 seconds to take that extra, wiping the pen, whatever the case may be, can be a lifesaver for patients. We just don't know, but we hear about all the hospital infections anyway. I mean, there's a lot of failures that happened with Paige. And the fact that she was put into an adult ICU, I think probably was the most egregious one, because I feel like she wasn't treated. She was 84 pounds. Granted, she was 23 years old, but she was tiny. And I've seen patients over the age of 21, or I've seen adult patients, especially in the cardiac unit at St. Joe's for kids, the pediatric cardiac. They have older ones. If they had a congenital defect from birth that was repaired, they go back for any repairs, because those are the surgeons who know what happened before. The adult ones don't know, and she had issues from birth. So right there alone, that was kind of, really was probably the biggest blatant thing that they really didn't pay attention to, because they're treating her like an adult, but she was not an adult insult from birth, because she had the cerebral palsy, she had the seizure disorder from birth. So it was a little bit different scenario. So we can't change that, but we can advocate for our patients. So when you see a patient like that, that might be in an adult ICU, that you think, wow, they've had issues right along. Do they have somebody? You can speak up and talk to the nurse and say, do you know if they have somebody? Or if you see the doctor on rounds going, geez, this was a pediatric case. Are they being consulted, or check the chart to see if they had them come in? Because that can be a difference, and you would never want them, the worst is going to happen is they're like, oh, well, no. As long as you make that effort, You know, even being a respiratory therapist, there's nothing wrong with that. Because you're advocating for the patient. Isn't that what we're supposed to be doing? You know, and I always tell a family, when a family apologizes to me and say, I'm sorry I'm being a pain, I always say, no, you're not a pain. You were the person, the voice for your loved one. So you need to be the advocate. You need to be the one that's saying, so never take it personally from somebody. And sometimes they point out things, you know what, you're absolutely right. You know, let me check on this. Let me try to do this. Let me contact the doctor about this. Because we need to advocate. You just can't go about, even when you're busy, you know, you want to go back and do that. And I always tell families, do not apologize for you being an advocate for your loved one. Because they'd have to have somebody, especially if those patients on meds. Or patients who can't advocate, whether it's a child that can't advocate for themselves, that parent has to be the voice. So that's something I think we all need to.
Paige was disabled. It made her disability made her life no less valuable than any of ours. And you also need to remember that when you're in the hospital working in that setting, everybody is all patients are at their worst. And I've seen a lot of misjudgment because people judge what they look like when they're in that bed. And just be careful about any misjudgment.
Well, I mean, how many times, do you have a question?
I was just gonna ask, thank you for speaking first off, that's very difficult as a mother. And second, I was just gonna ask if there's been any changes since this, event, either in that hospital or at that conference.
Actually, I met with hospital administration after she passed away, and the critical care doc that I spoke to, the pediatric doc that I spoke to, asked the adult hospital to hire a navigator so that they could help with the navigation and advocacy for the pediatric patients that are going into the adult world. I don't know if that happened because I'm retired now and out of the loop, but that was requested of administration.
Honestly, that's where my brain went, is there needs to be like an advocate to link the two worlds.
That's what she asked for in Paige's case.
Yeah, because you know, we have to learn from these mistakes.
Yeah.
You know, it's all said and good, and we can turn around and, you know, we can all talk about what's going on. But a lot of times it's that hospital administration that's got to go the extra step and say, yes, we need to hire somebody. We need to have somebody that's going to, especially in this case, you know, she was a pediatric patient, she's an adult age. It's not the same. They treated her like an adult and she was not an adult, even though she was in the size, well, not even the size of an adult really, but she was the age of an adult. You know, and I think they kind of forget that sometimes. And you got there again, it's individual treatment. It's not classifying people in one or the other. Just like we see people who are coming in their DNR. Yet they're sitting there and they seem totally fine. Well, a lot of people, well, they're a DNR. We're not going to do X, Y, and Z. No, that doesn't mean you don't treat. DNR status does not mean you don't treat somebody. It just means you don't do CPR on them. That's all. But it doesn't mean you're not going to treat them. They might want to have everything else done. So we sometimes, as health professionals, think you're met with their DNR. That's not comfort measures only. That's just DNR. Do not do CPR. Do not do resuscitation. And sometimes you get more specific whether you want to be intubated or not intubated, or compressions or no compressions. But regardless of that, it doesn't mean do not treat. So you don't treat that DNR patient any differently, with the exception of probably jumping in at a code, but because that was their wishes. But you do everything else. You can give chemotherapy, you can do infection control, you can do anything else. So never judge that patient, and that's what Linda was going to. Never judge that patient based on their previous condition. You know, we have patients who are drug addicts. Then we'll say we're not going to treat them. No, they get treated just like everybody else. Yes, it's unfortunate they have mental illness, hence why they're doing the drugs. There's a reason for it, but even more so, they deserve our full, you know, services, not by us judging them based on, you know, some social issues that they have, or, you know, still it's a mental health issue. We can't treat their mental health, but we can treat their body physically. So.
It's a very compelling story.
Yes.
Yes, thank you so much, Lisa.
Thank you for
And
inviting me.
I'm sorry for the loss of your daughter. What we're gonna do really quick, so people can take a quick break, use the bathroom. If you don't know, there's one outside here. If you go through those other double doors to the right, and then there's two bathrooms there. You can use those real quick. While we take a very quick, like, I'm gonna say 4-minute, 5-minute break. You get some water. Technically, you're not supposed to bring any food in here. Start the lights too.
Don't fuck your angel. No getting hurt.
Honey,
Yeah.
you go straight through there and to the right. And listen, you come back.
Oh, those are, you won't get locked out like that.
Janira. Jan.
Video first.
I see, that's not right.
That was a part of, I was just gonna, and let me know when you want the video to play. And here we're just gonna. Play with that in your. I just look she'd already had plans one way, but she's watching.
So then I like, once I started here.
I could wear sweat. I don't think we're really. Just like. Oh, I did that Thursday, Thursday, every Thursday. And what we'll do is, I keep, and I put it on every one. But, I'm gonna give you that day, that will enable me to. And I didn't put everything that I should have said last. Yeah. I can do things for you, get up, design. Have to turn it in ahead of time saying, I want another, or get this, but I got it. Does that make sense? Because we have a choice. But, and the punches are the idea of 5. I can give it to you, but it's gonna be different.
We are pointing.
We're working. We got it.
Got it. Here's our.
Daddy.
No.
The 14th, you can't pick up another day that week. Is he not working? You need to switch to your meeting. The first week, I'm not that worried about it.
We totaled at least 2 cars.
The 14th and 18th. You know what I'm looking at? Group, I just, 14th and 18th are the same week. I was on June. So that was my fault. Never mind.
Yeah, I'm here, I'm just like, I'm here. Don't hear it?
Yeah, we were outside. We were outside, we were back going to the bed. My husband ran out there, got his tag. He called off. That whole car. Well, then he tried to leave, and he hit, her, when he turned off our street. He sold his own car, so the cops got him. And then he was trying to say he wasn't an outside street. And they were like, and that's frustrating, all the neighbors were outside.
Honestly, not like, no.
Why? Good night.
broken your house.
I was trying to. Yeah, drunk driver. Totally.
I love that. What?
Maybe want water?
Carol, come in and drink it. But I, yeah.
Yeah, I really want.
Okay, we're gonna get started again. I just wanted to also, for those of you who maybe came a little bit late or whatever, the HCC Foundation, I asked them for snacks and the water things to have here, and, they graciously, actually, they gave us even more than I needed, actually even a gift card to Publix, so I went and bought a whole bunch of things yesterday to bring in, so it helped support and they actually helped me. I asked them for gift cards to give to our speakers, because they came a ways. You know, you're down in Cold Springs. You guys came from Newport Richey, which. Hudson, but I love it. So you came from Orlando area, correct? So, I mean, they really are dedicated to trying to improve, patient safety. So they're this dedicated, so I just want you guys to also appreciate that fact in the HCC Foundation also. I'll report that back to the foundation. They were very gracious. She actually, no, this is good. So, next we have Edward Salazar, as I mentioned, is a respiratory therapist, has been since, I guess, 1976. 1972, on the job first, is that how you? Okay. Right, there you can work on the job. So 1972. So he's a person to pick his brain because Ed did the oral exams that they used to have to become registered respiratory therapists. So you actually had to sit in a room and they kind of grilled you. Can you imagine having to do that? Yeah, it was like, I'm scared enough when Scott does his oral.
It's not the teacher, that's fine.
No, these were like doctors and everybody who were there sitting at the table, grilling you. So I can't even imagine that one, my God. But anyway, in 1975, in November, Ed had met the standards and qualifications for the National Society for Cardiopulmonary Technologists to qualify. Back then it was called a CPT, Cardiopulmonary Technologist. And then later he was hired that same year as the technical director of cardiopulmonary services at Northridge General Hospital in Fort Lauderdale. By the next year, that's when he completed his written and oral examinations and received the designation as an RRT by the National Board for Respiratory Therapy, that later became your NBRC. And his RRT number is 3527. And then in 1982, he established the Edward J. Salazar and Associates for the purpose of providing staffing services in ICU, PICU, NICU, and transport settings, and later expanded to representing medical equipment manufacturers. So he had his own business working in respiratory, dealing with an agency that he created so he could supply staff to, I guess, still down in that same area, right? Fort Lauderdale area. No, don't do that anymore. And then in 2008, we successfully completed the PRPT, which is the sleep, right? Was that the whole sleep? Right. So, all on sleep studies. So back then in 2008. And then in 2014, he authored and published A Free Kill, a telling of the events leading to the cardiopulmonary arrest and death of his son Christopher at age 28, while a patient in a trauma center ICU. And he's currently still advocating and working as an independent manufacturer representative and clinical specialist and patient safety advocate for the Patient Safety Movement Foundation that's out of Irvine, California. So let's welcome Ed Salazar.
We're gonna start his video.
Okay, as we talked about before the introduction, I got involved in respiratory therapy in 1972. It was kind of by accident. I originally wanted to be a physical therapist. But I heard about this respiratory therapy program. I was living in Michigan at the time. I heard that there was a brand new school in Fort Lauderdale, Florida. Boom. So I came down and checked it out, and I decided, this is what I wanted to do. In the course of my career, I've been an equipment technician. Believe it or not, we used to clean equipment. If we didn't have disposables, everything got washed, sterilized, processed, and we had to have personnel just to do that. I worked as a supervisor. I worked as a pulmonary function lab. Postgraduate, I did a one-year program for cardiopulmonary technology. We spent 6 months in pulmonary function at Mount Sinai, Miami. And we spent 6 months in a couple different cath labs. And, this is what I wanted to do. This is what I wanted to be the rest of my life. I got the offer to head the department at Northridge. And I thought, this is a dream come true. I'm young, I've got my own apartment. Well, I stayed there for about 7 years, and I realized I just failed terribly at middle management. I wasn't cut out for that. So I went back into clinical respiratory therapy where I was comfortable. We started that company that at that time, hospitals didn't have transport teams. All the hospitals didn't have their own transport teams, so there was a big need for that. So I had worked in the first neonatal units that were developed. I was fortunate enough to be invited to work in one of those at Broward General, Fort Lauderdale. And we decided to start this agency that had therapists that were trained to do air and ground transport. Well, slowly all of the other hospitals started developing their own in-house transport teams. So in around the year 2000, I would say I got seduced by the dark side. And I left clinical respiratory therapy again to go into medical assets. And that's, what I've pretty much been doing ever since. But real quick, I commend all of you for getting into respiratory, getting into allied health. There are an awful lot of things that you guys can do in this field. And there are an awful lot of good choices you can make. But you absolutely have to get a good, solid clinical foundation first. 5 or 6 years in a good, solid clinical situation, you guys can go do anything you want. But everything that I'd done or experienced, nothing prepared me for March 23rd, 2016. 3:00 in the morning, we got a phone call. You know, my son, he loved working in restaurants. He was a really good cook, a really good chef. He liked serving, he did bartending. He loved that atmosphere. He had a lot of friends in that area, and, you know, that's where he met his wife. And, you know, thanks to that, I had 2 beautiful granddaughters. I guess, you know, they stayed and they were, after work, they went to another restaurant, and, you know, there were some people together, they were having some drinks. He and his best friend were on their way home at 1:30 in the morning. While on their way home, they made a left-hand turn at an intersection in Coral Springs and got T-boned by a car coming the other way. Christopher was the passenger in the car, so he was making a left-hand turn, and he took the main force of the impact. Thanks to some very, very skillful first responders, they established an airway in the worst of possible conditions. Got him airlifted to the trauma center. 3:00 in the morning, I get the phone call. It would be in my best interest to get down to the hospital as soon as possible because my son had been in an accident. I said, how bad is it? And all the nurse said was, it would be in your best interest to get here as soon as possible. I've been in the field long enough to know exactly what she meant. The hospital was about 8 miles away. I don't even remember driving there. But I got, and I had told, you know, my wife, you know, just wait until I know what's going on and I'll call you. So I get there, I go into the nurse directs me to this room and she says, wait here. And the surgeon and the ER physician will be in here to talk to you. Now, I know this drill. I've seen this drill many times. So I got a sick feeling in my stomach, and I literally got on my knees and started to pray. The surgeon comes in. He tells me that it was very, very severe. He took a blow to his right lobe, and they put in a bolt to measure his intracranial pressure, and they were going to take him to surgery to try to evaluate, you know, how severe the injuries were. I asked if I could see him before he went to surgery. He said, sure. I went in. And this is what I saw. Oops. Sorry. Here we go. Now try to imagine, you know, I worked in ERs and have been involved in all sorts of situations exactly like this. But to walk in there and to see it as your own son, it was surreal. I just held his hand and squeezed it as hard as I could. And watched wheel him off to surgery. Now, I went to the waiting room in the hospital, this trauma center. Ironically, it was the same hospital that his mother and I met in. And I had left to go to Northridge. She stayed there, and she had become the critical care director, nurse director for all 3 intensive care units at that hospital. So she knew the hospital very well. They knew her very well. They remembered me. But, you know, we never had any complaints at all about the care he got. You know, he did extremely well. This was on, the 23rd of March. By April 1st, he's been weaned from the ventilator. Go to the next slide, just here. There's a wonderful publication online, and I remember what it is now, and it's called Caring Bridge. Caring Bridge. And, my wife knew about this, so she was able to kind of, because, we had all kinds of people calling all the time, wanting to know how he was doing, and you can't deal with that. So, my wife had set up this blog on this site called Caring Bridge. So every day she was able to post on a daily basis how he was doing, and family and friends and everybody could just log on every day and get an update on what was going on. And this is from April 1st. Update: Chris is being weaned off the ventilator. He's still connected to the machine, but he's on CPAP +5, 30%. He's breathing completely on his own. Saturation is good. He's being allowed to wake up. They're reducing sedation. He is following verbal commands appropriately. We had every reason to believe that this nightmare was going to be over. So on April 9th, this is what he looked like. All his facial trauma had been resolved. He looked like himself again, but he was still triggered, right? Now, I had been there while he was on the ventilator. I was there every night. I slept in his room. We prayed with him, and we watched everything that was done, and I had zero complaints about how he was treated. Once he was weaned off the ventilator, I stopped staying overnight. And but one of the three of us, either his mom, my wife, or myself, were there every morning to get a report and to get an update on how he's doing. The morning of April 9th was the only day that we weren't there first thing in the morning. And the reason we weren't was because we had gone to meet with a lawyer to set up a trust fund, because we were expecting a long, strenuous rehab. And, we wanted to be sure that there was everything to take care of that and to take care of the two daughters. So my daughter-in-law was there with us, and, we were with the lawyers, and we were there till afternoon. And got by about 3 o'clock is when I dropped Kathy, his mother, back off at the hospital. I went on home to take my daughter-in-law and my wife, Carol, dropped off our home in Coral Springs. I came back to the hospital. I got there a little before 5 o'clock. And Kathy had a very concerned look on her face when I got to the ICU. I said, well, what's going on? She says, well, like the video said, says she got in the room, she saw he was tacky, she saw he was desaturated. She asked what was going on, the therapist said, well, he's been like that all day. So she asked if he could have a blood gas. Now, at this point, 5 days before all of this happened, pulmonary had signed off the case. That's how good he was doing. So he hadn't had a blood gas, in 5 days. But something was wrong. 100% oxygen, saturating in the high 60s, and tacky. Okay, you guys see this blood gas, right? Every one of you can interpret this blood gas, right? How can you have an elevated CO2 and an elevated bicarb? no bicarb was given by IV. So it had to be metabolic compensation, right? How long does it take the body to compensate for metabolic acidosis? How long does it take to retain that much bicarb? Nobody knows for sure, but it doesn't happen instantly, right? Something had to have been wrong with that airway for at least 12 hours. Now, are all of you in RT? Okay. I don't want to, I worked night shift for many years. And I know, for instance, radiology has to come around in the morning to do the morning x-rays, right? They come around early in the morning, they're in a hurry, they're understaffed. And they should always get help from somebody when they're trying, in those days, you still had to put the plate behind their back and everything. And I had seen problems, ET tubes come dislodged, I'd never seen a trach tube become dislodged, but I've seen ET tubes come dislodged. So I knew that, if you see X-ray coming in to do their X-rays and the patient's got an artificial airway, help position the patient for the X-ray. So mostly just to protect your patient and to protect their airway. I don't know what happened, but something happened. And whatever happened had either been unobserved or unreported. Because there was nothing in the medical record to indicate that there had been any problem with the airway. But as they said in the video, I said, something had to have gone wrong. There's no other way that this could have happened. And my son's autopsy confirmed that the tube had been out of place. There were mediastinal tears from trying to force ventilation when the ET tube was malpositioned. Okay, so somebody screwed up, right? Somebody had to have screwed up. I was talking with Linda after her presentation. That's not right. I'm not very good at this. For a long time, we were just in terrible, terrible grief. But after a while, the grief started to turn to anger. And the more I thought about it, the angrier I got. And when the anger starts to fester, you better find something constructive to do with it. I had a friend from church who was a lawyer, and I talked to him about it. And he said, well, it would seem to me that you've got pretty much a slam dunk case for malpractice. I'm not going to go into spend a lot of time into this, but there's an other part of what happens during medical errors. Anybody here got a smartphone? If you do a search for third leading cause of death in the United States, you find something that you'll find quite interesting. A study was done at Johns Hopkins University some years ago, well, not that long ago. Maybe about 5, 6, 7 years ago. And they determined that the third leading cause of death in the United States was medical error. Now, why doesn't this get more attention? How can you have 400,000 deaths a year and nobody be aware of it? Well, there are two big reasons. Number one, there's over 3,500 critical care hospitals in the United States. So 1 or 2 deaths from medical error once in a while, it's not like 2 jumbo jets colliding every day. It's lost in the numbers. The number 2 reason is the CDC has no code for medical screw up. My son's cause of death on his death certificate was cardiopulmonary arrest. So extrapolate that out, you know, and you begin to appreciate what the issue is. You know, my message to you all as the respiratory therapy students. Number one, you know, you are in a great field. I commend you. You know, you can do some great things with this. But just remember, you know, what you do is important. But what you do can have serious consequences if you don't do it correctly. You know, and it's going to happen again. This organization, Patient Safety Movement, they're a great organization. They're doing a lot through collaboration of healthcare delivery systems, hospitals, and everything, to work together to try to come up with formulas and protocols, develop algorithms to prevent these things from happening again. But it is going to happen again. And when it does, just be sure you're not the one with your finger on the trigger. All these people that you're taking care of, all of them, there's somebody's child, there's somebody's father, there's somebody's mother, there's somebody's brother, there's somebody's sister, okay? And they all deserve every single bit of compassion that you've got. Thank you. Any questions?
You got any questions for Ed? Andrew?
What ended up being the actual problem with the placement of the tube?
It was malpositioned. It wasn't inserted perfectly into the trachea. But the position that it was in, there was enough air, some air was obviously getting into the lungs. But because elevated respiratory rate, elevated heart rate, and his CO2 was still 65, it just wasn't there. And you would think, you know, how did they miss it? How could they have missed that? You know? But again, he had been in that intensive care unit. That was his 18th day, 19th day in the intensive care unit. Pulmonary had signed off. There was a lot of discussion of whether or not he should even be in the intensive care unit because he was doing so well. So his acuity was determined to be much, much lower than other people that were just new arrivals into the trauma unit. And you know, if any of you have done any rotations through any of these trauma units, you know there's a lot going on. So, you know, I could understand how the nurses might, you know, not spend as much time with him as they do their other patients. But, you know, 2020 hindsight, this should have been, somebody should have looked into it. And there was another issue too. He had one critical lab value. It was an elevated serum CO2. And it was past the critical level. And the policy of the hospital was any critical value has to be reported. Okay, and there has to be a response from whoever's managing it. There wasn't. There's one other thing that I forgot to mention real quick. I'm sorry, let me go back to my slides. And this is something, you know, you're a respiratory therapist, but you're part of a team. And your responsibilities as a part of that team go beyond just your flow sheets. Remember, he was weaned off the ventilator on the 1st. They took him off the ventilator. The note said it. And there was an order to reduce the morphine. Anybody see where there was any reduction in the amount of morphine given? On the day that he coded, in a 14-hour period, he received 32 milligrams of morphine and 3 milligrams of Ativan. Ativan is for anxiety, right? You know, thing like, but you know, you all know that morphine can suppress respiratory drive, right? And Ativan is going to do nothing but compound that effect. How did this happen? Now, clearly, somebody screwed up. right? There was never any reduction in the amount of morphine he was being given after coming off the ventilator. We didn't, as a matter of fact, we were told the day before he coded that he had been getting weaned off the morphine, but it didn't show up on the medical record. There's a statute called sovereign immunity. Sovereign immunity is an old English term that basically means you can't sue the king. But in this context, it refers to organizations such as hospitals, tax-assisted hospitals, that there's a statutory limit on the amount of financial liability that they can be held accountable for. This trauma center was protected under a statute of sovereign immunity. And long story short, as such, there was at this time in 2016, there was a $100,000 limit on their liability for malpractice in a situation like this. It would have cost us a whole lot more than that to bring the case to trial. So our only recourse was to go to mediation. In the mediation, we had a whole team of lawyers that were representing the hospital, the ER physicians, the anesthesia group, all of them covered under that same umbrella for the trauma center for sovereign immunity. And all of them told us how sorry they were for our loss. I swear to God, if someone ever says that to me again. And after all that, they all introduced themselves, and cumulatively, the offer for compensation was $40,000. If you have any interest in this topic at all, look up another topic, Florida's free kill law. When I asked my lawyer, I said, what just happened here? He told me, he said, Ed, no lawyer representing clients covered under sovereign immunity will ever admit saying this, but they will tell their client, you have a free kill. There's nothing they, offer them whatever you want. Again, this was part of what motivated me to write that book, and that's where the title of the book comes from. So stay involved in patient safety issues. I think every qualified school in the country should be members of the patient safety movement. I think every honorable hospital system should participate and collaborate with the efforts of the patient safety movement. And that's really all I got to say. Thank you.
One thing I wanted to point out here too, he's off the ventilator, and I'm imagining he was getting, and his trach was dislodged and not in the right spot. How does the patient feel when that's happening?
Discomfort.
Discomfort. He can't verbalize, right? So he's agitated. What do they give him? They're thinking he's in pain, and they're thinking, instead of checking to see why is he having this, they're giving him extra morphine, they're giving him Ativan to reduce his anxiety. And what are they doing to his CO2 in that case? It's probably going up because he's not breathing as much as he should be, because he's getting 32 milligrams of morphine in that time period. So it played a part in whenever it happened that it got dislodged, which could have been a transport, could have been a lot of different things, could have popped technically, but could have been an x-ray. But listening to breath sounds, doing your assessment, double checking, when you see things change, and question also. Why was he still having so much morphine? I mean, he had a major accident, so no doubt he was in some pain. But they said to reduce it, and then it seems like they gave him more than they gave before, so.
Because he probably got agitated.
Because he couldn't breathe.
Yeah.
So. Anyway, thank you so much, Ed. Thank you for sharing your story. All right, so let me get Ed's flash drive so I don't forget it. So let me move along. So now we're going to have Mrs. Darlene, Christy. I'm not light. Oh, wrong one. You turn off the lights. Nobody's the wrong. Some don't even work. Darlene Christy has been a resident of the Tampa Bay area in Florida since 1995, from relocating from Philadelphia, Pennsylvania. She had a remarkable 15-year career traveling nationwide as a medical education researcher, recording doctor visits and interviewing patients and physicians to help train medical students and improve doctor-patient communication. While advocating for and caring for her husband, Earl, through his prostate cancer treatment, she became a board-certified patient advocate and launched her own boutique consulting firm, Find Healthcare Champion, to remove barriers to quality care and help empower her clients to take charge of their own healthcare. Darlene is also a community educator, speaker, writer, and serves on various committees to promote patient safety and help improve patient health outcomes. So let's welcome Christy. I can switch on 5 of you.
Good morning. Thank you all so much for being here. Just being able to listen to Linda's story sharing about her daughter Paige and Ed's story sharing about his son Christopher reminds me of why I became a patient advocate. I am just so, even though we've all been through a very daunting experience, just being here, I feel such gratitude because you all are such a powerful, powerful group to be able to make a difference. And it's just an incredible moment for me because Earl's journey is still very fresh for us. He just literally got off of a ventilator 2 months ago. So this is all very fresh and very new. As Linda mentioned, I became a board certified patient advocate. I got certified in April of last year. And during my experience as a medical education researcher, I was very aware of the lack of communication between patients and their providers because I was there videotaping hundreds of visits between doctors and patients and also interviewing them. But I had no idea of the impact of complications when there is a breakdown in communication from the medical team, from the team that is caring for a patient when they're not communicating with one another. But I learned that firsthand when my husband, Earl Christy, almost lost his life, not once, not twice, but 3 times due to complications from medical error. First, it was a misdiagnosis, and that caused delayed treatment, and then fragmented care, where the providers were not communicating with one another. And as Ed mentioned, many people compare how many people lose their lives due to medical errors to a jetliner crashing. And we know that the number is hundreds of thousands of people a year. And it is literally staggering and it's unacceptable. And the difference is when a jetliner goes down and you have 200 and some people dying at one time in a crash, and healthcare, they're killing one person at a time, and it's happening many times a day. And if it's not someone who is a celebrity or famous, we'll never hear about it. So today, even though, again, we've all gone through daunting experiences, it's very emotional for me to sit here and hear Linda's story sharing about Paige and Ed's story sharing about Christopher, and taking it back to what I'm going through and knowing that many, many people a year are going through the same thing. It's a great time to be here because you all are such a powerful group. And just because you all showed up, it shows that you are all positively inclined to make a difference. So you should give yourselves a hand right now for being here. Because this is a very, very powerful group. So just to humanize the story, my husband Earl Christy's here now. And before we leave here today, we want to form a partnership with you all that today you all will make a commitment as allied health professionals to take part of this patient safety movement, as Ed has mentioned, and make a difference. Save people from medical harm, save lives. So I want to share Earl's story. On December 21st, 2021, Earl came home from grocery shopping. He's the only person I know that loves grocery shopping. He would go grocery shopping every single week. And when he would go grocery shopping, he would come home and have his hands behind his back. He would bring me flowers every single week. And he will always be so excited, whoever he met at the grocery store or whatever deals he found. And on that day, I was on the phone with a client and he came in. And when I looked at his face, I knew something was wrong. He looked like he had seen a ghost. So I quickly ended the call with my client and I said, honey, what's wrong? And he said, they found cancer. And I heard what he said, but I just needed him to say it again to make sure. I said, what do you mean? He said, the doctor's office called. They found cancer. And I said, okay. And I said, let's go in the bedroom because my daughter and granddaughter were there and I didn't want them to hear any of it. So we went into the bedroom and the first thing we did was we prayed. We didn't talk about it. I didn't ask any questions. We prayed. And after we prayed, we both had this profound sense of peace. It was like we knew somehow everything was gonna be okay. Like we didn't know what the journey how it would unfold, but we found peace. And the only other conversation we had was whether or not we were gonna tell our families before Christmas or after. And we decided to wait until the day after Christmas. And I left out of the room and then I heard this beautiful tune. I heard Earl in the bedroom singing Amazing Grace. And it was just the most beautiful thing because we both had found peace with whatever was gonna lie ahead. Fast forward, we started treatment 6 weeks later in February. And I remember going to the doctor's office and the doctor saying, we caught it early. You won't die from the cancer. And I thought, okay, that's good news. And it turned out to be 100% true because it was actually the treatment and the delay of treatment after a misdiagnosis of complications and also lack of communication between the providers that almost took his life. So the treatment plan was going to be hormone therapy. It was going to be radiation, 25 treatments, 5 days a week for 5 weeks. And then there was going to be brachytherapy surgery, which was a seed implant surgery. So that was the plan. Earl started the hormone therapy, which was an injection. It was a Lowman injection. And about, I would say 3 weeks into treatment, he began to have wheezing and shortness of breath. And because we had had such a big road ahead of us, when we reported it to the doctors, they diagnosed him with seasonal allergies. And I thought, okay, allergies, we can handle that. They give him the seasonal allergy medication, loratadine. But I do remember thinking, that's odd. I didn't even know he had allergies. But it just kind of was something that stuck in my mind. It didn't sound right. But I didn't question it because we were so focused on what lied ahead. As the weeks went by, the allergy medication was doing nothing. He was actually getting worse. And we wound up participating in a study called the Huddle Study. It was for NFL alumni, and it was a study on heart disease for African Americans. And one thing I remember that they said in the study was that if a person is having heart failure, they may have swelling of the feet and ankles, and they may have wheezing and shortness of breath. And when we leave the study that day in Tampa, we went to Orlando because Earl is a motivational speaker and he was speaking to a graduating class, just like I'm standing here speaking to you all. And I remember as he was speaking, I was thinking that he sounded like he was struggling. He was having shortness of breath and wheezing. And anybody that knows Earl knows that he does not need a microphone, okay? When he is speaking, you can hear his voice just bellowing throughout wherever he is. But that night, he was struggling. And when we got back to the hotel and he took off his shoes and socks, his feet and ankles were swollen. And I remember thinking about what we had just learned earlier that day. And I also remembered, as he laid down, he started wheezing. And that was just so odd because even though he had been having the shortness of breath before, the wheezing was a new thing. And I remember them saying that if a person is in heart failure and they're having these symptoms, that if you prop them up on pillows and you elevate their feet, that can cause, some relief. And so I did that and it did help. But I remember laying in the bed the entire night listening to him breathe because he sounded like it was just really bad. And I was actually afraid to go to sleep. So the next morning we wake up, I call his primary care doctor. And I told her, I said, you all are treating him for allergies. The allergy medication is not working. I think there's something wrong with his heart. I said, we participated in a huddle study or a research study. And they said that if a person is in heart failure, that they may have swelling of the feet and ankles and wheezing and shortness of breath. And if you do, prop them on pillows and elevate the feet, that it may give relief, and it did. And she had us come straight into her office from Orlando to her office in Tampa. She checked Earl's oxygen and listened to his heart, and she got us a same-day appointment with a cardiologist. And they put him on furosemide. The cardiologist said that they were going to give him one test a week for 5 weeks. They did an echocardiogram in the office, and then they scheduled one test a week for 5 weeks. It was a EKG, a stress test. It was a venous and bilateral ultrasound. So that means that there was going to be one test a week for 5 weeks. Now, Earl had been diagnosed with prostate cancer, and he was actually starting radiation that same day. So when we left the cardiologist's office, we went to the oncologist's office, and they had already instructed us that Earl was to drink 24 ounces of water every day before treatment. And sometimes we would get there and they would have him go back and sit in the lobby because he didn't have enough water in his bladder and he would have to drink more water just to get treatment. So we had 5 weeks of that. Now, mind you, during this time, he's declining. He's getting more short of breath. He's having more wheezing. The swelling in his feet and ankles, it had moved all the way up his legs, his thighs. By the time we got to like the 3rd or 4th week of treatment, his legs were so heavy that when we were going to treatment, he would have to put his backside in the car and I would have to lift his legs into the car and lift his legs out of the car. So this was really heavy for him to drag around these heavy legs. And anyway, so by the time we get to the end of treatment, we were also at the end of the 5 weeks of testing that the cardiologist was doing. And at that time, the cardiologist said to us, you have dilated cardiomyopathy, which is an enlarged heart valve. Be sure you're not drinking more than 1.5 liters of water a day. So by that time, the damage was done. Earl had been drinking all of this water every day for radiation. I had never, even though the cardiologist knew that we were doing radiation, I never mentioned anything about the water because I assumed that a cardiologist would know that if a person is having radiation, that they're drinking X amount of water, but apparently I was wrong. And there was no communication between the cardiologist and the oncologist, only other than what I was reporting as I'm coming in. But when he said that, I said, well, this is why he's having all this swelling. Now, when he was having all this swelling, mind you, I was calling the primary care doctor. I was calling the urologist that diagnosed him with prostate cancer. I was calling the oncologist who was seeing him every day anyway for 25 days. I was reporting to everyone, something is wrong. He's having all of this swelling. The shortness of breath that you're calling seasonal allergies is not the medication's not working, so I was reporting this. And when they, when he said that he had dilated cardiomyopathy, at that point, we were done with the radiation, but the damage had already been done. So about a week later, Earl had a follow-up visit from the oncologist after the radiation was done. By that time, he was really in bad shape, really in bad shape. I was having to, every time he had to use the restroom, I was having to lift him up out of his chair because he was just so weak. You know, I mean, imagine carrying around all of this, at the time, we didn't know it, but fluid in your body. So when we went to the visit, for the follow-up visit, I said to the oncologist, I need you to look at his legs and his feet, and I need you to call his primary doctor right now, not tomorrow, not next week, right now, while we're here, and tell her what you see. And he did. He called her. And she had us come straight to her office, just like she did when I first reported that he was having wheezing and shortness of breath. And when we got to her office, she took his oxygen. His oxygen level was at 86. And his feet and legs were so swollen, she sent us straight to the emergency room. And he was admitted. He was in the hospital for 18 days. And at that time is when they diagnosed him with congestive heart failure and pulmonary effusion. During that time, he had gone from 195 pounds to 239 pounds. He had 44 pounds of fluid in his body, and it had gotten into his lungs. So this, when they diagnosed him with seasonal allergies, it was because he was having fluid in his lungs. So he was in the hospital for 18 days. He was in ICU for 10 days. And one thing that I do want to point out, because he was misdiagnosed, and when things like this happens, it causes other complications. So when he came out of the hospital, he was in like a different person. He was using a walker. He was on oxygen 24/7. They had him on 4 liters of oxygen. 30 days later, we're at home one day and he gets up to go use the restroom. And he literally almost collapsed, and I caught him just in time. I got him back to his chair and he sat there and he dozed off for a minute and he woke up and he started saying, "Where are we? Where are we?" And I said, "Honey, what do you mean? We're in our living room." He said, "Where are we?" I took him back to the emergency room. When we got to the emergency room, they diagnosed him with hypercapnia because he had been on this high level of oxygen for that time period. And because his lungs had been compromised with the pulmonary effusion, he was not able to exhale fully like you and I would. So he had retained all of his carbon dioxide in his lungs. And his level of carbon dioxide in his lungs, they said, was 3 times the normal person. They said that he could have just gone to sleep and didn't even wake up. So for that hospital stay, he was in the hospital for 10 days. He's in the hospital for 10 days. He gets out. Now he's discharged from the hospital and he has to use a BiPAP machine, which blows the carbon dioxide out of his lungs for him because he was not able to do that. He wound up being on that machine for 18 months. So that's what I was explaining, that he just got off of that. He had to sleep on that machine every single night. And now he's off of that. But about 30 days after that discharge, the next complication was him telling me that his stomach was hurting and that the ventilator machine was causing it. And I said, "Well, what do you mean? The ventilator machine is making your stomach hurt?" So I went online real quick and did some research, and I learned about air swallowing. And apparently he had experienced air swallowing and he got bloated and indigestion type symptoms from the ventilator. And Earl had already had a pre-existing hernia here that had been there since he was born, he says. And when he got very nauseated, he wound up throwing up. And when he came out of the bathroom, this hernia had popped out. It was like protruding. I could see it sticking out from underneath his shirt. And I said, oh my gosh, what happened? And he said, I don't know, I threw up. And we go back to the emergency room. He's admitted to the hospital. They took him straight to trauma surgery, and they had to repair this strangulated hernia. So now he's in the hospital for another 12 days. So a total of 40 days in the hospital within a 90-day period because of a misdiagnosis, delayed treatment, and fragmented care. So it causes other series of complications. And one thing I can say is that now, as of now, Earl is now cancer-free and thriving. He's doing very well. But he was one of the very fortunate ones because, as you've already heard, Linda's story and Ed's story, this is happening far, far too much. It's happening far too much. And while Earl was in the hospital is when I got to be there. I stayed with him in the hospital for 30 days. This was during the pandemic. It was a huge blessing that I was allowed to stay because many people weren't even able to visit their loved ones. I know of another patient advocate. Her name is Mary Daniel. Her story has been throughout the news. She wound up getting a job as a dishwasher in a facility just so that she could see her husband during the pandemic. She lives right here in Florida, and she's in my Health Advocates of Florida group. But so me being there for Earl was a huge blessing. But you know what? It also let me see how many people do not have someone to advocate for them. Either they're too sick to advocate for themselves, or they don't have family members nearby. Visitations were limited specifically during the pandemic, but it allowed me to see that. And while Earl was in the hospital, I went to the library and I printed out the paperwork and I started studying how to become a patient advocate. I didn't know anything about patient advocacy, but I knew I had to do something. And it's what Gina has touched on, Linda has touched on, and Ed, is that we must do something. And you all as allied healthcare professionals must do something. You know, this is what you signed up to do. This is what you signed up to do. So I have been very inspired. When this first happened, I was really upset. I was angry, I was frustrated. I wanted to go give the doctor a piece of my mind, to be honest with you. But I never did that. I allowed my frustration to turn into passion. I am extremely passionate about patient safety, patient education, collaboration, communication between the medical teams is critical. So that's something that you all have the prime opportunity to make a difference. Me just being able to sit here and listen to the stories today, I learned a lot. I learned a lot from Linda. I learned a lot from Ed. You know, we can all continue learning from each other. So I'm so grateful for this opportunity. So I had a chance to go onto your website for Hillsborough Community College, and I read the mission statement. And it says, to transform lives by providing open access to an exceptional teaching and learning environment that inspires students to contribute to the local community and global society. Patient safety, it's a public health concern. Medical harm is a global health crisis. I also read on the website the integrity statement for Hillsborough Community College. It says operating with transparency, accountability, and the highest level of professionalism. It didn't say average, it said the highest level of professionalism. So when you all enrolled in the health sciences program here, again, that's what you signed up for. Our great Dr. Martin Luther King said that not everyone can be famous, but everyone can be great. Because greatness is determined by service. Service. Be great. Be excellent as servant leaders. That's what you signed up for. Because you can make a difference. You can save people from medical harm. You can save lives. And you may be sitting and thinking to yourself, what can I do? What can I do as a medical professional? Well, for one, be great. Be excellent. Go the extra mile. Take an extra 30 seconds and wipe off a keyboard. Okay? Linda talked about that. There's things that you can do. Wash your hands. You know, if you see something going on that doesn't seem right, say something. There's a lot that you can do. You can make a commitment today. Make a commitment today. I want to see everybody in here who's making a commitment today. That's what I really want to see. I want to see a show of hands. Who's making a commitment today to make a difference? When you hear stories like what Linda and Earl and Ed has gone through, make a difference. It could be your family member. Make a difference. Make a commitment to promote a safe and positive culture for patients, but not only for patients, for the workforce. Because if the workers are overworked and not in a safe culture, then that's dangerous for the patients. Make that commitment. Be excellent. Get involved in the patient safety movement, as Ed mentioned. Get involved. Learn what it's about. Find out what you can do to make a difference. Encourage collaboration and open communication between patients and the providers, between the medical team. Research shows that a positive patient safety culture, it reduces lower readmissions to the hospital. It lowers hospital-acquired infections. It lowers falls in the hospital. It lowers medication errors. The list goes on and on. Patients report having a better care experience when there is a positive patient safety culture in place. So that's what you can do. Go do research and learn how you can make a difference. I read your student handbook. It says, when students succeed, we all succeed. As Ed has mentioned, if it's your mom, your dad, your brother, sister, child, or best friend, pick one, any of your loved ones. They're not feeling well. They go in to receive health care. I want to see another show of hands. How many people in this room want our loved ones to receive quality care when they go into the hospital or the doctor's office? Is there anybody in here who doesn't? That's what I thought. That being said, in closing, I implore you all today, be the change that we all want to see. Be the change. Thank you.
Want to get a picture? I was standing back there doing the slideshow. That was awesome. Thank you, Darlene. See much as a patient advocate. You know, she does a great job with that. I mean, it's actually, yeah, well, yes, I mean, and I thank you for doing everything that you have done.
Yes.
Get to, all of you actually gave, you know, from the heart. I mean, we can tell. We can actually tell. We're gonna sum up for today because we have Earl the Twirl, Christy. Now, you guys are all too young to understand. Earl was a professional football player. They called him the Twirl for, you know, actually it was mostly sports. I was reading this actually online after, you know, beforehand. I knew his background, but I was like, oh, he played baseball too. And then he played basketball too. You know, I think you did track too, didn't you?
Yes.
I was like, wow. So talk about, you know, a talented athlete. My God. But his little background, he's an all-around athlete who traveled the world playing, and this I did not know, show basketball with the Harlem Wizards, and was celebrated in track and field, and inducted into the Baseball Hall of Fame in college at the University of Maryland, Eastern Shores. So obviously we have a phenomenal athlete. Hailing from a small town in Pyramid, Maryland, Earl made a lasting mark in football history as a pivotal member of the world champion New York Jets, catching the opening kickoff in Super Bowl III. He helped propel the team to victory over the Baltimore Colts in an epic game that forever changed NFL. Earl later embarked on a broadcasting journey and spanned over 5 decades. His voice resonated across the airwaves of CBS Radio, ESPN, and has been a sports agent, a 2-time Teacher of the Year, a game inventor, inspirational speaker, ordained archbishop, and has spent his entire life as a youth minister. He was engaged in mission work in South America and other parts of the world, and has taught and is honored as a chief in Ghana, Africa. Now, Earl also wrote a book, The Earl Christy Story, the story of a Super Bowl champ, and it documents his amazing journey and embodies his resilience, versatility, and unwavering dedication to inspiring others. One of Earl Christy's favorite mottos is, "Your attitude will take you to the altitude." Despite any challenges he's faced, Earl Christy has an infectious energy and captivates and has greatly impacted the lives of many people around the world. So I'd like to welcome Earl Christy. He doesn't need the microphone.
First, giving the honor to God, the Creator. I am so elated, emotional, what I've just witnessed here, and I gotta thank you. I gotta thank you so much for giving us the opportunity at Hillsborough College. And you know, I have fond memories here. When the Jets were tailgating, we tailgated in your parking lot, okay? And that day, Rex Ron, just real quick, I received the game ball because I talked to the team the night before. That's the only time I rooted against the Bucks, okay? Wow, when I think about hearing Linda's story, it's so touching, so touching. And the admiration that you have to come and share with these wonderful students is elating. And the same thing. I mean, really, I'm just so blessed to be here today. I've been very emotional because these things are good because it's all about you. It's all about us on the same team. Just real quick, TEM, TEAM. What does that stand for? Team. Together, everyone achieves more. And we thank you for being here today. Okay, now, amazing, and I gotta say, my wife, literally, you saw some pictures, fighting for my life, the passion and everything. And by the way, folks, I gotta tell you, this is her first time ever speaking in front of public. Did you not? Yeah. That Tina, you really put pressure on a retired athlete and a minister, giving them a mic, okay? So I'm gonna try to cut it down, and you guys have been great audience, okay? But I just want to share this. Have you ever given it your all? Just think about that statement. Have you ever given it your all? When you hear great speakers like this today, you can't help for not giving your all. And I'll just give you an incident. When you talk about giving it all, when I was in college, they gave me the nickname of saying, he's a roper, he never runs down. Because every time I step out on the field, I gave it everything. That's the same thing in life, in business or whatever you're doing. You give it your all. And I remember when I went to the pros and I'm catching a kickoff or punt return, I was a running back, defensive back. I would catch the ball in practice and run to the other goal line because I visualized Every time I touch the ball, I want to score a touchdown. And that's the way we live in life. When you give to each other, caring about each other, and you're in the field that talks about giving and caring. It's amazing. I commend you. I had the good fortune of being a teacher, physical education teacher, and I always used to tease people about what's the most important subject in school. And everybody would say English or math or history. I said the most important thing was physical education, because I don't want to take no math test that I ain't feeling. Your health is your wealth. And then I think about being at Maryland Eastern Shore. And I had a roommate, and I played baseball there. And I remember, your foundation is important. You guys got a good foundation because you made a choice to better your life. To better your life by going to school. Because education is so important. I'm so happy that I've had the experience, and it's because of my family. My family, they instilled into you the foundation of caring about one another, loving one another. And I believe, and Lord, you're gonna make this society a better place to live because you're in the right field. Man, when you get to the point where giving is more important than receiving, you truly are on the right path of life. That's what it's all about. Every day, give it your all when you step out there. And when I look at having the opportunity to literally travel all over the world, I can remember I went to the Holy Land. What a unique in Jerusalem, having the opportunity to be blessed, to be baptized in the Jordan River. But you know what makes me so happy? When I see people that are working together in our society and loving one another. I can remember my wife and I, we came up with a t-shirt called Each One, Love One. I know this is the key. Wherever you do in life, just want to have passion for it. I don't know no other way. I go all out. That's what it's all about. And you get so much joy. You know what? I compare happiness with joy. Happiness may last for a while, and that's good. But joy lasts forever. Having the opportunity to do things that you love to do, I'm telling you, give it every time when you're there. That's what's fun about it. Doing something, being in a career that you care about people and enjoy every day. To see the smile. I just was looking at some of you guys when you were out on the break. It's just so amazing. I could just see the joy and the happiness. And that's what the Creator intended us to do. Be happy in this world. That's why I created all of us. I got a few things here. I always like to put letters together with words. And by the way, and my wife, Darlene, talked about it. Remember this. Don't let nobody tell you nothing. You were born for greatness. You were born for greatness. I want you to repeat with me. I was born for greatness. 1, 2, 3. I was born for greatness. Give yourself a hand. Come on. I have so many favorite words, but one of my favorite words is attitude. Your attitude will take you to your altitude. It will take you as high as you want to go in life. There's no limit how high you can go in life. I know it. It's real. A young man coming from a farm, had to work in the garden, raising animals and everything. Didn't have a lot of money, but we had love. Family together. That is so much. Money can't buy this. Then the other A, appreciate every day that we're breathing. Man, we take that for granted. The breath that we breathe, we take that for granted. Can you imagine? Hold your breath. You know how it feels. And the A, accomplished. And I talked about it. Give it your all. Give it your all. The big B, believe. Come on, you gotta trust in something. You gotta trust in yourself. You gotta trust in each other. Because we're here all together. Balance. It's good to have balance in our life. Just like a spokes in the wheel, if you take it out, it starts walking. But balance. You work hard, you play hard. Whatever you do. You know, and one of the things I learned not to worry. Good gracious. I'm so blessed my grandmother gave me that spiritual foundation. Yes, it's good to be concerned about things, but don't worry. Give it your best. And that word, be best. When you become, and you're going to be accomplished in the medical field. Man, every day that you go to work, it ain't work when you're doing something you love to do. Man, I want to be the best at anything. I don't care if it's teaming wins or whatever. I want to be the best. I just that spirit. And it's so much fun. And you know, sometimes, and we're going to have trials and tribulation, and we're not always going to be successful in winning. But man, it tells me, I remember when I got hit and knocked to the ground, and I'm almost half out, I'm seeing stars. And then I said to myself, if I can breathe and I can look up, I can get up. And that's what it is. You get knocked down. Man, don't quit. You get knocked down. Good night. Oh, and the C, real quick. Character. Boy, that's what's so important. Oh, man, I just met these two wonderful folks today. Man, you talk about character. Genuine character. The love and the joy. Man, I get joy out of seeing people happy. Man, I'm telling you, boy, it's just amazing. And then commitment, dedication. Man, I'm gonna do something, I'm gonna do it right. Well, I'm not gonna want to do it. I'm gonna have fun with it. And then the big C, another one of my favorite. Care. People don't care how much you know. They want to know how much you care. I repeat again. People don't care how much you know. They want to know how much you care. That's what it's all about. Dreaming. Boy, you talking about a dreamer. Man, I'm a big dreamer. We don't remember all our dreams. Never stop dreaming, young folks. Never stop dreaming. I dream. And I take the word dreams. D-R-E-A-M-S. If I misspell it, help me out, okay? The D in dreams, like I said, never stop dreaming. Boy, I used to dream, boy, I hope one day, man, I might play pro sports. I hope one day I might go to Florida. Come on, I was just happy to be on a Greyhound bus. Was the greatest thrill in my life. I didn't know nothing about it. I mean, I was on the school bus. And when you talk about school, I went to school 12 perfect years. That's right. First to the 12th grade. Now, I didn't say I wanted to go to school all the time, but I thought about might have to stay home and did some cutting grass or cutting wood. So school was my best toy. I remember my grandmother told me one morning, she said, you don't have to go. I was feeling sick. and everything, and she said, you know, something just came over me, so I turned it around. But it's so important. There are so important respect. And respect starts with yourself. See, we sometimes beat up on ourselves. Respect, have that self-esteem. Education. Oh, man, I can't thank my grandmother enough. When you cease to learn, you cease to live. When you cease to learn, you cease to live. And of course, we talked about the attitude, big A and Q. Mindset. The mind can be the most powerful thing and could be the weakest. I always tell young folks, especially in school when I'm teaching, you pick your friends, don't let them pick you. You know, because a lot of times we are following. And I even had a tough time in school because I never drank, I never smoked, I never tried to use drugs in my life. You know, I remember some guys saying, well, we're gonna make you worry. Well, I said, come on with it. But the bottom line, the mind can be strong. Man, stay to the true self. And the big S, success. Success. There's different ways of having success. And then I've been very blessed to be able to win all my life. I lose some, I win some. I have a saying when I used to talk to the football team in the meetings or in chapel and everything. I always said, the only thing better than winning is more winning. Forgive me, English teacher. Okay, that's winning in life, not just on the sports field. Anything that you do. And a beautiful part. The big W, W-I-N, 3 letters. Work ethic. Are you willing to pay the price? Are you willing to give it everything when you step up? It may take me 4 hours to do something, and it may take you 8. Are you willing to pay the price to do that? I know, I feel in my heart, you're gonna make an impact in this society. Today, when you go today, after hearing those stories, it's amazing. And I just take my hat off to you guys going all over and giving your story. That is painful. And I might as well share too. My daughter died from kidney failure because she was having her second, my oldest second child. But we're gonna have tragedies in life, but we gotta deal with them. We gotta get stronger, and we gotta share and help people, okay? And the big aim, never give up, never quit. Man, it's gonna get tough. It ain't say it's easy. It's not easy going to school, especially in physical education or the medical aspect, because you got to learn a lot of things, but y'all just keep doing it. Even when you keep going, like I said, when you cease to learn, you cease to live. Okay, in closing. Oh, man. This is a poem that I wrote, and I want you to listen to it very carefully. Very carefully. The name of this poem is, This is Life. Life is love. Share it. Life is an attitude. Improve it. Life is amazing. Be thankful for it. Life is a blessing. Receive it. Life is a light. Turn it on. Life is hope. Don't give up on it. Life is a hug. Embrace it. Life is precious. Treasure it. Life is a challenge. Meet it. Life is a gift. Accept it. Life is an adventure. Dare it. Life is a sorrow. Overcome it. Life is a tragedy. Face it. Life is a game. Play it. Life is a duty. Perform it. Life is a mystery. Unfold it. Life is a song. Sing it. Life is an opportunity. Take it. Life is a journey. Complete it. Life is a promise. Fulfill it. Life is a beauty. Praise it. Life is a struggle. Fight it. Life is a goal. Achieve it. Life is a puzzle. Solve it. Not least, life is a purpose. Live it. God bless you. Let's continue on it. Let's go for it.
That was awesome.
I gotta get my wife to make up some.
Christy, for coming and sharing and passion, and I think he's great. So I want to thank you for sharing your passion is what I said.
Oh, yeah, man.
Yeah.
Please, I can't help it. No. This has been my life work. Being a former teacher, I taught in 6 different states in America. Okay? So this is my life. I'm living it every day. You got it. Okay?
Yeah, I don't get to use it to myself.
And y'all can do it, and I know you want to get out of here. Anything? Okay?
You guys want to take a stack with you, bro? Anybody who ordered a shirt that didn't get one yet? Anyone else? I have a few shirt. I also just down in the you go both days next week. I drove down there and I'll send them a thing that they can go home. You can, I see that someone else is sorry, yeah. So I know Fabiani's going, Jennifer's going, and Sheila's going.
Did she knock it at the bottom? Did she knock it at the bottom?
Nice to meet you. Thank you so much. Thank you. It was so nice to meet you. Thanks to you. I do have a card. Yes.
I'm here and I'm glad you can help patients in the future.
God.
Give it back to me. I can see the
Oh,
color.
yeah. I tell you, that's what.
I'm not sure if Jeremy's not gonna see it.
What's the context?
I didn't have to send,
It's okay, it's okay.
But I do have an ICU contact.
yeah, I just have to.
My former medical director is at Salazar, so I've got a contact there now, and so.
Very nice. Well, I'm excited to see the first one where you
You have wonderful, but, well, thank you. What Ed said, get a foundation, and, if you are working independently, like doing home health care, that's not, no, if you're in a setting where you're working side by side, that's where you'll learn from working with a lot of other people, and, that's what.
Unique about you work in all clinical areas. Any place where there's not, like you guys work, that's the entire hospital.
That's why.
That's all, right? That was God. I just loved it. Yeah.
And also this is really great.
Yes, oh, absolutely, yeah. Oh, absolutely. No, he's.
You know that's the key.
You want to know that? But for my daughter, it would have been better if she passed this sooner and didn't suffer. For me, it was better that it took longer because it gave me time to process. But a friend of mine, they lost their son 18 months ago in a skydiving accident. It was sudden, and I thought, how do you wrap your head around something that sudden?